Hello, I'm Dr. Rama Aysola with Head of Business Development for Alertive Healthcare. Thank you for joining. Here to talk about remote physiologic monitoring and who we are and how we partner with clinicians to improve patient outcomes. So we started Alertive to prevent heart attacks and strokes. Dr. Nirav Shah, former director of stroke medicine at Swedish Hospital, is our founder and developed our first app. We really want to focus on improving the outcomes for the higher risk, higher acuity patients. And our differentiation is that we are looking to tie this remote physiologic measures with medication management and medication titration to improve outcomes. This is the team. Dr. Nirav Shah is a stroke neurologist. Our founder, Dr. Jorge Sanchez, is our chief medical officer. He'll be overseeing our care team, which interacts with patients, documents the interactions, and escalates patients that we're concerned about to the clinicians for medical management. Noah Manders, our chief technology officer, he will be in charge of how we will work through EHR integration and workflows to maximize the benefits of RPM. Myself and Shock Jackson, we run the California and the Southwest, would be the point people for an RPM program to ensure success. And Danny would be the person to make sure everything runs smoothly and seamless. So we're a full turnkey platform. We use only FDA-approved devices. We have a mobile app available on Apple and Android, and we also have cellular devices, the LTE devices, for patients who do not have a smartphone or may not be that technically savvy. The data goes real time to our dashboard. This is a view of the mobile app. We support multiple physiologic measures, blood pressure, weight, pulse ox, glucometry, temperature, ECG, activity tracking. And also through our platform, we are able to support video visits. Through the platform, you can reach directly out to the patient via text or phone, and this will support the management of the patient while you're able to see their real-time physiologic measures. This is an example of an actual patient of ours who started with us on October 10th, and within a month, we were able to bring him to normal tension. And the lines of those dotted lines, vertical lines, are when the physician actually titrated medications to get patient to goal. We are a full turnkey service, meaning that we will support enrollment of the patient education of how the RPM program works and how to use the device and upload readings. We can help you find qualified patients through the EHR based on diagnosis and other eligibility requirements. We can enroll the patients either remotely or in person. Train staff to enroll. It's pretty easy to bring a patient onto the platform. We also support the technical aspect of the monitoring, the transmission of data, and also have a care team overseen by Dr. Sanchez, which will reach out to the patient, interact with the patient, do medication reconciliation, lifestyle modification, everything else except medication titration or adjustment of meds. But you can do that through our platform, and we also provide full billing support. So truly full turnkey. I would like to show you a brief video. So we're Alertive Healthcare, and again, we are full turnkey in our process. Here's our platform. As the data is coming in, it's risk stratified. You can see patients, hypertensive patients, whether stage 2, crisis, hypotensive, same for blood glucose and oxygenation. So the data is coming in real time. We're going to check in on a crisis patient. We're able to quickly bring up all the patients who are in hypertensive crisis. We're going to check in on Jorge patient, looking at his systolic is at 191, and he's located at the healthcare organization hospital. We have seen that over the time, he has been significantly spiking in his blood pressure. We can zoom in on those times and see, get more detail about those readings. We can also call the patient or text him through the platform. All this interaction is documented on our platform, so we can see the history. You also see medications and the time they're taking the medications, and their history. The blood pressure averages over 7 days, 30 days. We have a tracking of the consent and what devices we've deployed to the patients and their insurance information. who's onboarded them as well. From here, we are going to go into a telehealth visit with Jorge. Let's check in on him. So we start the viewer. In this visit, Jorge is going to be, we're talking to him. He shows how he received devices through the mail and speaking how he was onboarded by our clinic, by our staff. Took him about 5 minutes to be on the platform. That's a picture of the bio patch, which we also do ECG and respiratory rate. Here's a view of our co-browsing feature. So what we're able to do is, as we're onboarding and educating patients on the platform, is we could co-browse, see what they're seeing on their mobile phone, and help them navigate. Through the app, the patient can see their blood pressure history, their medication history. Here's a video of the patient taking an actual reading using the mobile app. Again, we do have cellular and LTE devices for patients who do not have smartphones. We also have the feature of manual entry. So say the patient would want to have upload multiple readings, they could have a blood pressure cuff and also enter, say, their weight, so there's a CHF patient, or their temperature, glucose, what have you. We have reminders in the mobile app and easy ways to get a hold of technical support and customer support. Device tutorials as well. We can remotely enroll patients. We get consent, ship the device, educate them. Here we're talking about Jorge has reported a cough through the mobile app, through text. So we have record of that. We're going to initiate another telehealth visit. After reviewing his physiologic measures, we see that his respiratory rate has been going up in association with his reporting of the symptom of cough. So let's get this visit going. We also see his ECG, look at his P waves, and make sure there's no atrial fibrillation or other possible symptoms that could be contributing to his cough. Here we're speaking with Jorge again. He shows that he has the patch on. He's described he's wearing the patch. It's comfortable. It's easy to manage. That's where we're getting the ECG data from. Here we're able to compare that telehealth visit with the physiologic measures. We could adjust medications through the platform as well. We could add additional medications and select the time that we want him to take it. Keep track of that so we can see how his physiological measures vary throughout the day in association with his medication regimen. We provide full billing and language support. In the billing view, you can see what the CPT codes or how billing has been progressing. We also have ability to hold accountable your care team. If you choose to do that in-house, you can see values on patient churn. Our team speaks English and Spanish. Our mobile app is available in Spanish as well. So with that, we're Alertive Healthcare. We would love to partner with you on your remote physiologic monitoring endeavors. And please keep in touch and not hesitate to reach out. Thank you for your time and thank you for listening.